Hello colleagues, this is my discussion and presentation on the treatment of schizophrenia. Statistics reveal that approximately 1% of the population over the age of 18 are afflicted by schizophrenia, and these findings are fairly consistent worldwide. It is considered both a mental and neurodevelopmental disorder that is often characterized by a deterioration of thought processes and emotional responsiveness, abnormal social behaviors, and failure to understand what is real. These characterizations are primarily governed by certain neurotransmitters within the brain. Now, we know that neurotransmitters are the messengers of the brain because they carry information from one brain cell to another. While there are many neurotransmitters within the brain, the two that have been linked to schizophrenia are dopamine and glutamate. Early investigations believed that the neurotransmitter serotonin played a role in the etiology of schizophrenia, but later findings concluded that it did not. However, antagonism of serotonin at the 5-HT2 receptors has been indicated in the improved neurological side effect profile of new antipsychotic treatment therapies. The dopamine theory of schizophrenia suggested that the disorder manifested from dysregulation of dopaminergic brain pathways, which ultimately resulted in overactivity of dopaminergic function. The revelation stemmed from two primary facts. One, the abuse of stimulants like amphetamine, which are notorious for increasing synaptic dopamine intensity, generate a syndrome identical to the paranoid type schizophrenia. And two, antipsychotic medications are dopamine receptor antagonists that block dopamine receptors within the brain. Glutamate theory of involvement stems from the findings that psychedelic drugs like PCP and ketamine yield some schizophrenic-like symptoms such as hallucinations, out-of-body experiences, negative sentimentology, and cognitive deficits. Mechanisms responsible for these outcomes is a strong obstruction of NMDA-type glutamate receptors, which suggests a glutamatergic dysfunction and the etiology of this condition. Ultimately, the theory suggests that NMDA hypofunction causes too much release of excitatory neurotransmitters glutamate and acetylcholine within the frontal cortex, resulting in the injury of cortical neurons, which activates the declining process seen in patients with this disease. Schizophrenic patients are most commonly treated with antipsychotics. The antipsychotics utilized in the treatment of this disorder work by blocking dopamine receptors, particularly the D2 receptor. Excessive levels of dopamine are linked to schizophrenic-like symptoms. Thus, the primary goal of treatment is to decrease the amount of dopamine being released into the brain. Worth noting as well is the finding that patients with this condition have more receptors for dopamine than those without the disorder. However, it is still unclear whether the disorder is caused by too many dopamine receptors or if the large amounts of dopamine receptors is a product of the illness or treatment. These medications also block acetylcholine, histamine, and norepinephrine receptors. Future developmental efforts in the treatment of schizophrenia are focusing more on drugs that can increase NMDA activity in an effort to reverse the aforementioned hypothesized deficit. If medication is discontinued, the relapse rate is approximately 80% within 2 years. However, with continued treatment, only about 40% of recovered patients endure relapse. After 10 years, of the individuals diagnosed with the disorder, 25% make a full recovery, 25% improve enough to be relatively independent, 25% improve, however, they do need extensive support networks, 15% are hospitalized, and there is a 10% mortality rate. After 30 years, of the individuals diagnosed with the disorder, 25% make a full recovery, 35% improve enough to be relatively independent, 15% improve, however, need an extensive support network, 10% are hospitalized, and there is a 15% mortality rate. The benefits of treatment far outweigh the risks. Though antipsychotics come with a number of adverse side effects, they are more beneficial in managing symptoms of schizophrenia than leaving patients untreated. Untreated patients are at an even higher risk of suicide, being placed in jail, becoming homeless, and developing chronic substance abuse problems. Such conditions only exacerbate the underlying issues. Thus, it is my expert opinion that antipsychotic treatments are the most viable option, perhaps coupled with psychotherapy and support groups, when endeavoring to improve the overall quality of life for these patients. And that concludes my discussion. Thank you.